There are things that many women over 65 experience in silence, not because they aren't important, but because no one has given them a calm, clear space to talk about them. Intimate dryness is one of those things, a sensation that can range from mild discomfort to a sense of distress that affects daily quality of life, complicating routine activities as simple as walking, sitting for long periods, or simply existing comfortably in one's own body. And yet, many women do not bring it up during medical appointments because they feel embarrassed, because they believe it is inevitable at their age, or because no one ever explained to them that it has a name, a very specific physiological cause, and, most importantly, real options for managing it. Today, we're going to talk about all of this with the clarity and respect this topic deserves. Why intimate dryness appears after age 65, what exactly is happening in the body, and what you can do, with or without medical treatment, to improve your well being safely and effectively. To understand why intimate dryness occurs after 65, one must first understand the role estrogen played in maintaining the health of vaginal tissues throughout reproductive life. Estrogens are female hormones that, among many other functions, keep the vaginal mucosa moist, elastic, and well supplied with blood. They stimulate the production of a natural secretion that lubricates and protects the tissue. They maintain vaginal pH in a slightly acidic range, which functions as a protective barrier against infections, and they preserve the thickness and elasticity of the vaginal wall tissue. When estrogen is present at adequate levels, this entire system works quietly in the background. But when estrogen levels drop, as naturally happens after menopause, that system begins to change. These changes accumulate over time, so symptoms that might have been mild at 52 or 55 can become considerably more intense by age 65 or 70 if nothing has been done to manage them. What occurs in the vaginal tissue when estrogen decreases has a medical name: vulvovaginal atrophy, though in recent years the term genitourinary syndrome of menopause, GSM, has become preferred because it better describes the full scope of the issue. The vaginal mucosa thins, the walls lose elasticity and become more fragile. Natural lubrication production drops significantly. Vaginal pH rises, meaning it becomes less acidic, which reduces natural protection against bacteria and fungi. The blood vessels supplying the area decrease in number and efficiency, further reducing the tissue's ability to stay moist and well nourished. All of this combined produces that feeling of dryness, itching, burning, or irritation that many women describe. It is not something in the imagination. It is a real, measurable, and documented tissue change that affects a very high proportion of postmenopausal women. Some sources estimate that between 40% and 60% of postmenopausal women experience symptoms of vulvovaginal atrophy to some degree, and that proportion increases with the years elapsed since menopause. This means that at 65 or 70, the likelihood of experiencing these symptoms is considerably higher than at 52. One reason this issue tends to worsen over time, in addition to the progressive decline in estrogen, is the lack of stimulation. Vaginal tissue, like many other tissues in the body, responds to use. Regular sexual activity, including self-stimulation, maintains blood circulation in the area, stimulates natural lubrication production, and helps preserve tissue elasticity. When that stimulation ceases for extended periods, the tissue tends to atrophy more rapidly. This does not mean that sexual activity is the sole solution, but it is a real physiological factor that deserves to be mentioned honestly because it is part of a complete understanding of the problem, and because many women are unaware that a lack of activity can accelerate the atrophy process. There are also other factors beyond menopause that can aggravate intimate dryness and are worth knowing about. Smoking reduces circulation to peripheral tissues, including the vaginal area, and can accelerate atrophy. Certain medications frequently used by older adults, such as antihistamines, some antidepressants, certain medications for overactive bladder, and some breast cancer treatments, can additionally reduce natural lubrication as a side effect. General dehydration also plays a role. A poorly hydrated body has fewer resources to keep all its mucous membranes moist, including the vaginal mucosa. Finally, frequent use of scented soaps, harsh shower gels, or alcohol-based wet wipes in the intimate area can disrupt the natural pH and vaginal microbiota, worsening irritation and dryness. So, what can a woman over 65 do if she is experiencing intimate dryness? The options are more varied than many realize, ranging from simple adjustments in daily care to specific medical treatments that have advanced considerably in recent years. 1. Over-the-counter vaginal moisturizers. The first line of defense is OTC vaginal moisturizers, which should not be confused with lubricants. Lubricants are used on an as-needed basis to facilitate sexual activity, and their effect is temporary, lasting a few hours. Vaginal moisturizers have a more sustained effect. They are applied regularly, every 2 or 3 days, and work by restoring tissue moisture continuously, much like a moisturizing cream works on skin. There are vaginal moisturizers formulated with water, hyaluronic acid, or other substances that mimic natural lubrication. Regular use can significantly reduce dryness, itching, and irritation. They do not require a prescription and are available in most pharmacies. If you haven't tried this option, it is a reasonable first step that can make a noticeable difference in daily comfort. 2. Lubricants. The second level includes lubricants. While they do not address chronic dryness structurally, they are useful for immediate relief in specific situations. They come in water-based, silicone-based, and oil-based formulas. Water-based lubricants, the most versatile and generally recommended option, especially if used with condoms or silicone accessories, as they do not damage these materials. Silicone-based lubricants, longer lasting, but not suitable for use with certain silicone accessories. Oil-based lubricants, including natural oils like coconut oil, these can be gentle on tissue but alter vaginal pH and are incompatible with latex condoms. Choosing the right type depends on its intended use, and a pharmacist can guide you if you have questions. 3. Medical options and prescriptions. The third level involves having a conversation with a doctor, a step many women avoid due to embarrassment or the belief that no solution exists. However, medical options for postmenopausal intimate dryness have advanced enormously, offering effective and safe treatments for the vast majority of women. Local hormone therapy, one of the most studied and effective options. It involves applying a small amount of estrogen directly to the vaginal area via creams, suppositories, or rings. This restores the tissue locally without the systemic risks associated with oral or transdermal hormone therapy. Because local absorption into the bloodstream is extremely low, it is suitable for many women who cannot take systemic hormone therapy. However, it should always be evaluated individually with a physician, particularly for women with a history of breast cancer or other hormone-dependent conditions. Non-hormonal prescription options. Drugs like ospemifene act as selective estrogen receptor modulators, CRMs, targeting vaginal tissue without being estrogens themselves. Energy-based treatments. In recent years, procedures such as fractional vaginal laser therapy or radiofrequency have emerged. These stimulate collagen production and tissue regeneration. They require multiple sessions and carry higher costs, but they provide significant symptom improvement for some women. Availability varies by region and healthcare system, and they should always be performed in medical centers by qualified women's health specialists. None of these options are a sign of weakness or failure. They are medical responses to a real physiological change. Just as no one hesitates to treat high blood pressure or elevated cholesterol as natural consequences of aging, postmenopausal intimate dryness deserves the exact same level of care. It is not vanity. It is not a luxury. It is quality of life, and quality of life after 65 matters just as much as health in any other sense. Daily care habits to consider. Everyday care of the intimate area also deserves a review, as some common habits may be worsening the problem unknowingly. Soap and washing. The vulva, the external area, does not require special soaps, scented products, or active ingredients. Plain water is sufficient for external cleansing. If soap is used, it should be fragrance-free, dye-free, and neutral or slightly acidic in pH. Scented soaps, standard body washes, and alcohol-based wipes disrupt the local microbiome and can worsen dryness. The internal vaginal canal has its own self-cleansing mechanisms and should never be washed internally. Vaginal douching is explicitly advised against by gynecologists because it strips away protective natural bacteria. Underwear choices. Synthetic fabrics trap heat and moisture, creating an environment that can irritate delicate vulvar tissue. Cotton underwear allows for better ventilation, reducing local heat and moisture buildup. Sleeping without underwear, if comfortable for you, can also benefit intimate tissue health for women with chronic dryness or irritation. Overall hydration. General body hydration directly impacts all mucous membranes, including the vaginal lining. After age 65, the sensation of thirst naturally declines, leaving many women chronically underhydrated without realizing it. Maintaining adequate fluid intake, around 6 to 8 glasses of water daily, will not single-handedly cure vaginal atrophy, but it provides the body with the necessary baseline resources to support healthy tissues. Nutrition. Diet can play a modest supporting role. Foods rich in phytoestrogens, plant compounds with weak estrogenic activity, like soy, flaxseed, chickpeas, and other legumes, have been studied regarding menopausal symptoms with variable results. In some women, they may offer mild relief for dryness and hot flashes. While not a substitute for medical treatment when indicated, they have no major contraindications for most women as part of a balanced diet. If you have a history of breast cancer or hormone-dependent conditions, consult your doctor before significantly increasing phytoestrogen intake. Additionally, omega-3 fatty acids found in fatty fish, walnuts, and flax seeds possess anti-inflammatory properties that support overall tissue health as part of an anti-inflammatory diet. The emotional impact. There is an aspect of intimate dryness that is rarely discussed, yet deeply impacts many older women: its effect on emotional well-being and self-esteem. Chronic discomfort in such a personal area can affect psychological health in ways that go far beyond physical irritation. It can create anxiety, a sense of loss, emotional detachment from one's own body, or sadness regarding age-related bodily changes. These feelings are completely understandable and legitimate. Addressing this issue holistically means recognizing that this emotional dimension exists and deserves care. Speaking with your doctor not only about physical symptoms, but also about how they affect your broader quality of life, can open up important conversations about treatment options that might not otherwise have been considered. Many women wait years before discussing this issue with a physician. Some never do. During that time, tissue continues to change, symptoms can escalate, and quality of life unnecessarily suffers, not from a lack of solutions, but because silence stands in the way of access. If you recognize these symptoms in yourself, know that options exist. Your gynecologist or primary care doctor can guide you. Vulvovaginal atrophy is an established medical diagnosis with recognized treatments, not something you must accept as inevitable. Seeking help for something that affects your daily well-being requires no justification. The female body after 65 has navigated decades of change, adaptation, and quiet strength. It deserves the exact same care and attention as any other system. Intimate dryness is a common, well-understood, and treatable medical condition, and addressing it openly is what allows life after 65 to be lived with the comfort and dignity everyone deserves.